on the work we've been doing in Wales to understand why people from Black, Asian and minority ethnic backgrounds have been disproportionately affected by coronavirus. Research has suggested that more than a third of people critically ill with coronavirus in English, Welsh and Northern Irish hospitals were from BAME backgrounds, compared with 18% of the UK population. We also know that many health and social care workers who have died from coronavirus were, of course, from BAME communities. We don't yet fully understand why. There will be a number of reasons and complexity behind this. We also know that people from BAME backgrounds have higher rates of some underlying health conditions, such as type 2 diabetes and hypertension, which may put them at greater risk. Over the last month, we've been working with Public Health England and NHS England to understand these underlying factors. But we have also been doing our own work here in Wales. The First Minister set up an advisory group to develop updated public advice to help protect the health and well-being of BME communities in Wales, and to provide some more tailored advice for health and care workers. The advisory group has been chaired by Judge Ray Singh, and it had two subgroups. The first is looking at workforce risk assessment issues and any additional safeguards which might be needed. And the second is looking at wider socio-economic factors that might influence poorer coronavirus outcomes in BAME groups and any actions that might help. The advisory group will be reporting its initial findings by the end of this month, in line with the anticipated reporting date for the Public Health England research. But I'm very pleased that the risk assessment tool developed by one of the advisory group's subgroups is being introduced today. And I'd like to place on record my thanks to Professor Keshar Singhal and all the members of that group for the huge amount of work that they have done to develop this tool. So the All Wales COVID-19 Workforce Risk Assessment tool is sensitive and supportive. It's a two-step process. In the first instance, people will consider each of the identified risk factors and complete the self-assessment. This will indicate the risk as low, high, or very high. They will then have a supportive and structured conversation with their line manager to consider the actions which can be taken to ensure that they are protected as far as possible. This could range from changing working practices to reduce the risk of transmission, refreshing infection prevention and control training, a change in role to reduce the risk of being exposed to coronavirus, or where this is not possible, the potential to stay at home on temporary medical leave. The risk assessment will be available throughout health and social care in Wales. Its use and impact will be monitored and kept under review, and we'll be working with stakeholders to support its rollout. Before I take questions, I want to say a few words on testing. Last week, I set out how we were moving to a UK-wide website, which would enable people to book a test if they had symptoms of coronavirus. Initial figures show that in the first 4 days of the new online booking system, more than 600 tests were completed by people in Wales using this route. We're finalising work on the process of bringing the testing centres in Wales, which are run by different organisations, onto the online booking system. Subject to some important final testing, I expect these sites to be offering online bookings by the end of this week. In the meantime, there are easy links to the booking arrangements for these centres from the UK website and indeed our own Welsh Government website. I have, though, heard some reports of critical workers being referred to testing sites as far away as Devon or in Hereford, and that is not acceptable. Testing is available in Wales for Welsh critical workers. We will continue to work with the providers of the UK website and the 119 telephone system to iron out any of those quirks within the system. The weekly testing update will be published today as usual. We're making good progress with the contact tracing pilots which are running in Cwmtach Morgannwg, Powys, Beti Cadwaladr and Hywel Dda Health Board areas. Thank you, and I'm now happy to take some questions, and I go to my list, and we start with Felicity Evans from the BBC.
Minister, thank you very much. We've seen some deeply worrying figures recently about the impact of lockdown on the economy. Add to that the concerns about its impact on mental health, social exclusion, domestic abuse, and so on. Wales is now probably the most cautious nation of the UK in terms of its approach to easing lockdown. Just talk me through the balance in terms of, how you compare the adverse health and welfare implications of such a strict approach to lockdown versus the health and welfare implications of the threat of coronavirus. And are we approaching a point now where the former begins to outweigh the latter?
Well, thank you for this. I think it's a really useful question to reiterate that this isn't simple. So the Chief Medical Officer set out 4 potential harms from coronavirus. The direct harm from people who suffer harm, as we know, and we sadly have the figures that we're still going through with a daily death total and hospital admissions. There's the indirect harm that could be caused to the NHS if it was overwhelmed by coronavirus. That's part of the reason why, of course, we set out to create that network of field hospitals to guard against that. And we saw the impact of that in northern Italy in particular. And the third harm is the way that people change the way they use services. The final, of course, is this point about the harm that comes from lockdown itself. So from the outset, we've been clear that there's a harm that comes with lockdown as well as a protection it's provided in saving lives. The harm to the economy, but also the harm to people who are understandably having to stay within their home. That's still the message. Or if they're going out for one of those permitted reasons, the advice to stay local. And the dislocation in normal relationships because people can't mix as they would like to do, whether those are children or they're adults, and in particular some of the intergenerational challenges as well. So we're of course considering all of those as we move forward, and this week we'll have to make another set of choices about the regulations that are in place, what the next set of regulations will look like. And you heard the First Minister speak last week about understanding the real heartache that this is causing for some families who can't see other members, and we would like to think about how we could do something on that. But I think the cautious approach is still the right one, and it's overwhelmingly supported by members of the public. And you saw, of course, the pictures from this weekend on beaches in England that were packed, and beaches in Wales where people are following the rules and understand the importance of doing so to keep all of us safe here in Wales.
Thank you. In your opening statement, you were referring to the pilots that you're running over track and trace. Andrew Morgan, the leader of the WLGA, suggested at the weekend that the IT system for test, track and protect will be ready by the first or second week in June. I know that originally you were aiming to have it up and running by the beginning of the month, but is that your estimate? And are we on track for, say, mid-June at the latest? Because obviously without that, you can't begin to ease lockdown in any meaningful way, can you?
Well, we expect to have track and trace available for the start of June, but there'll be then a rollout of further software to take us forward. So we're going through different stages. At this point in time, track and trace would be very different in terms of its scale because of the limited amount of mixing. As we make different choices in the future, we'll need that more sophisticated IT architecture. And I think Andrew Morgan's comments show that it's been a real partnership between health, the Welsh Government and local government on designing and creating this test, trace, protect system, because it is a really important part of giving people confidence that they can go to work in larger numbers or then go to use those businesses or services, whether they're public services or indeed parts of the economy that we want to help to switch back on. So yes, I expect we will meet our timescales. I expect we will have the rollout of the IT system, and you can expect that to be in place through the summer, building on the pilots that are taking place now in those 4 different health board areas across Wales. Thank you, Felicity. The second name on the list is James Crichton-Smith from ITV Wales.
Minister, thank you. People can now order a home COVID test kit, but when we go to the government website, it often says the drive-through tests in Wales are unavailable. Given that, how confident are you that people who need a home test kit will get them quickly?
Well, we've bought into the UK system. As you know, we're part of that now. And so that's about delivering home testing kits at present. And for the wider public, again, we'll start with critical workers for the integration of those drive-through centres to book those tests online. Other arrangements, as I said, are well understood and in place already for critical workers. And then again, over the next week or so, I expect us to be in a place where the public can book those tests in those online centres as well. And all of these things matter, of course, because as we move to test, trace, protect and the rollout of that, we'll want people who are being advised to self-isolate to be able to order a test. And that could either be home delivery, it could be someone travelling to a test centre where they won't have contact with someone else to have a test administered or to be able to do it themselves. So it matters for our ability to see all of this happening and to move forward. That's why I think that you and members of the public can have some confidence that over this next week we will see real progress made in the online booking of our drive-through testing centres.
Shops in England are set to open next month. Is Wales going to do the same? And if not, how do you stop people living on the border taking advantage of looser English rules?
Well, we haven't had the cabinet discussion yet. We haven't made our decisions, and we haven't had a Four Nations conversation between all governments in Cobra, because that hasn't met either. So the cabinet of the Welsh Government will be considering this week the rules, and the First Minister will announce any changes on Friday, as he has done previously. Our message to everyone, though, is to follow the message that we have. That is to stay at home, and if you need to leave for one of the permitted reasons, then to stay local and stay safe. And that will remain the message until we're in a different place to have some new guidance and advice on what lockdown will mean here in Wales. Because the Welsh Government wants us to be able to move out of lockdown, but to do so in a way that keeps Wales safe. And I think that's really important. And again, what we've seen from opinion polling and consistent evidence is that people of Wales are with us on that, and they support this cautious approach being taken. And as well as the government setting rules, of course, individuals have to take responsibility for some of their own conduct and their own choices. But you've seen already that people in overwhelming numbers are following the rules here in Wales, and I'm very grateful to the people of Wales for continuing to do so. We've now got Dan Bevan from Global.
Thank you, Health Minister, and good afternoon. As someone who has been accused of flouting lockdown restrictions yourself, are you sympathetic with Dominic Cummings and his situation, or do you think that what he did was indefensible and that he should resign?
Okay, so as you know, I've said this several times before. I didn't break the lockdown rules, and the accusations are people who want to try to avoid and ignore the facts of what happened. A local walk with my family within scooting distance of my home for a 5-year-old child, that's definitely local. We bought food in accordance with the rules, we ate in accordance with the rules, we returned home in accordance with all of the rules. Now, I can say that if I had driven to the other end of the country to see a family member when I thought that my wife could be potentially symptomatic with COVID-19, that would have been a clear breach of our rules in place at the time. And my position as a minister would have been untenable. It isn't for me to make choices about the Prime Minister's senior special advisor. What does matter to me, there was not so much the fate of Dominic Cummings and his job, it's actually whether people across all four nations, including here in Wales, are going to continue to follow the rules to keep all of us safe. And my real concern is the loss of public trust that comes from the ever-changing circus of the last few days. And that's what really concerns me. So some clarity in the rules and expectation, and a clear understanding that the rules are there for all of us, for me and for my family, and for everyone else's family, including those who work for the Prime Minister as well. And that's some of the upset that I think that we've seen take place. And I would like us to be able to all move on from this particular story and to focus on how we continue to keep Wales safe, how we work with the other three nations within the UK to do so, and how we're able to move out of lockdown as soon as possible and as safely as possible.
Thank you. And the First Minister said on Friday that the Cabinet hadn't made their final decision on whether lockdown in Wales will be eased, if at all. You've said today already that that decision still hasn't been made. So when will it be made? And also, when will people in Wales, more crucially, get a better idea of when they'll see their family and friends again?
Well, as you know, it's one of the issues that we're considering about how families may be able to see each other. And it's a very difficult question because, as I said already this morning, part of the challenge will be we'll have a range of potential choices that we could make to ease out of lockdown. We need to consider those individually, and we'll then need to consider them together. And it may be that we can't do everything that we might want. We'll have to choose on some measures to ease from lockdown, but others will have to remain in place to make sure that we're not risking serious harm to the public. But I understand that heartache that people feel. I feel it myself with my own family, and I know the First Minister recognises that too. You can expect to hear, as indeed the whole public can expect to hear, on Friday when the First Minister announces any changes to the rules here in Wales. As he has done on more than one occasion, he'll be the First Minister on Friday making clear directly to the public on the record what changes, if any, are going to take place and when they will apply from. Thank you, Dan. I've now got Adam Hale from the Press Association.
Thank you, Mr. Gething. What percentage of people need to comply with a 14-day quarantine requirement in the track and trace programme for it to be successful? And are you concerned that people perhaps won't be complying with that requirement?
Well, we're not working on having a particular percentage of people who have to comply, but it's a self-evident that the more people that do comply, the more effective we'll be in halting the spread of coronavirus. And it's part of the reason why trust matters so much, because we'll be saying to people that we want them to self-isolate, to get a test, and if they're positive, we'll be saying to their contacts that they should self-isolate as well. So we're relying on people doing that. We're not trying to take legal powers to force people into self-isolation. That would be a really big step, and I think quite difficult to police. But we're in a position where you can already see from today's ONS reports that looking back with deaths in the community as well, that it looks like more than 2,000 people in Wales have already died from coronavirus. So the seriousness of this couldn't be greater, and people have understood that, which is why the public have reacted so well in overwhelmingly supporting the lockdown rules. We'll need more of that community adherence and recognition that what we do not just affects ourselves, but affects other people, not just in our friends and family, but other people that we may not know. So we're relying on the public to follow the rules and to do what we're suggesting they do to keep themselves and others safe, and that lies behind the test, trace, protect strategy.
Thank you. And don't mean to invite a political pile-on here, but perhaps it's important, if you think for the people of Wales to hear from you, Mr. Gething, just what would happen to them if they're caught travelling outside of their local areas in search of emergency childcare before restrictions are eased over here? Would they be breaking the law? Can they expect to be fined? And what effects would travelling large distances have on transmissions of the virus?
Well, we know that travelling large distances, particularly for people who are symptomatic, is an obvious risk of spreading the virus. That's why the rules are in place to prevent that happening. The police have had another fairly busy bank holiday weekend. So I've had a conversation with one of the police and crime commissioners, and I've seen the figures and the reports they provided. Most of the fixed penalty notices they provided have been about travel transgressions. So we're already policing that. But the starting approach is to try to educate people, to then ask them to comply with the regulations. It's only if people are refusing to comply that fixed penalty notices do then get provided for those really significant breaches. Now, that's been the right approach to take, and we've seen widespread compliance with the rules here. But if people wanted to travel outside that for any purpose, and they couldn't justify what they were doing within the rules, within the law, then they could expect enforcement action to be taken if they didn't return to where they were. So I can be really clear that, as I say, if I'd driven to the other end of the country in the same time frame, then I would have been breaking the law, and my position as a Welsh Minister would have been wholly untenable, and I would have had to resign. That's the clarity of the position here in Wales. It's for the Prime Minister to resolve issues for him and his staff, and to understand the message that sends to the people here in Wales and across the rest of the UK about whether we are really all in this together, and they understand that all of us need to still be in this together to get through to the other side in a post-coronavirus world sooner rather than later. I've got Mark Smith from Wales Online.
Thank you very much, Health Minister. Would you recommend driving 30 miles or any amount of miles for that matter to test your eyesight?
No.
Thank you very much for that. Secondly, there have been calls for national cancer screening in Wales to restart urgently in Wales. Do you fear that cancer diagnoses are now being delayed and maybe missed, and is now perhaps the right time to resume these services?
We're actually considering what to do to restart parts of our health and care system. Now, as you know, urgent care has remained available throughout lockdown, but we've seen a number of people who are reticent about taking up those urgent care services that are still available. We've got plans in from each health board that my team are reviewing here, and I expect to make a public statement next week about what turning back on larger parts of the health service looks like. I've also authorised a framework to allow that to take place, for that planning work to take place within our health and care system. So you should hear in the fairly near future what that looks like here in Wales, and I hope that'll give the public the confidence to return to the system, but also our staff the ability and the latitude to come back to replan and re-deliver those parts of the service. Because as I said in answer to the first question from Felicity Evans, we do recognise that lockdown itself causes other harms as well as preventing that much wider and potentially catastrophic harm that coronavirus would have caused if we hadn't moved into lockdown when we did. Thank you, Mark. We've now got Rob Taylor from Wrexham.com.
A week ago, the First Minister spoke of a possible peak in North Wales, and the public can obviously see the confirmed case figures. Can you update on the situation in North Wales? And are you able to share some data such as hospital admissions, numbers in ITU compared to capacity and recoveries? And if not now, perhaps after the brief.
Yes, I'll happily make sure we can provide you some figures on where we are on hospital figures and hospital intake, because we have got those figures by health board area. It did look like, though, when I last looked, and we're seeing it's getting over the peak within North Wales, which is good news, of course. We're still in the position where North Wales has had a significant impact, but less so than the three health boards in the south-east corner of Wales. Aneurin, Bevan, Cardiff and Vale and Cwmtaf Magadaig are still the most significantly affected in terms of not just the numbers of deaths unfortunately have taken place, but also in terms of the wider harm and impact that's been caused on a per head basis as well. So I'll happily make sure that after this we provide that information to yourself, Rob, about what the figures look like in North Wales and some comparison with other parts of Wales too.
Thanks. On testing, 6 weeks ago you said you'd prefer a modest backlog to work through rather than not having enough referrals coming in. The latest data said that there's been 3,000 tests taking place. How many tests a day can take place? And if there's still a deficit, why hasn't it been sorted out yet?
Well, we could still undertake, I think, about 5,700 tests. Off the top of my head, I saw the figures earlier today about our sampling capacity and our lab capacity combined. Now, part of the reason we've seen an increase is because we are going out and testing more significantly across care homes. So we've got a rolling programme. I think in the next 2 to 3 weeks we should have all care homes tested. And it's actually partly about the demand that's coming into the system as well, because our critical workers are able to be tested. And when I've asked employers in those areas in the last few weeks whether they've got access, they've all broadly been content. They've got rapid access to testing for their staff when they need it. And actually the ramping up of the testing in care homes is allowing us to test the ability of the system to test in much larger numbers before we go into test, trace, protect, which will be really important to be able to continue to test at potentially an even larger level. And now that we're also taking part in the UK programme, we have some robustness in terms of also alternative ways for people to get their tests as well. So I'm expecting we'll see more people looking for tests as we move further out of lockdown and as we do go through a wider spread of test, trace, protect. So I'm content with capacity as is now. And next week I hope to give you and the public a wider update on a further increase in testing capacity. Thank you, Rob. And I've got Tom Magner from Carers World Radio.
Good morning, Minister, or good afternoon. Thank you for taking my questions. A couple of them, if I may. The first one, on the one hand, there's slow progress medically. For example, new research today suggests that a faulty dementia-linked gene doubles the risk of severe COVID-19. You've mentioned concerns indeed over the BME population. On the other hand, there are English people packing beaches, being impatient and thoughtless about the vulnerable. How does this contrasting reality figure in your thoughts about easing lockdown?
Well, human behaviour is really important for us, and to understand that there are people who are thirsting to leave lockdown, people who want to have that human contact that they've had to restrict. And again, that act of self-discipline from so many people in Wales is so important to put us in the position we're in now, where we can consider removing further restrictions. But we've got to be able to manage that in a way where we don't see the big splurge of activity we've seen in England. And there's a difference, I think, between having a set of rules in place to guide behaviour and broadly a message about asking people to trust their instincts. And I think we're still taking the right approach by being cautious here in Wales, because it is both about protecting people who understand who are vulnerable, but also those who may not think they're at risk. Because harm is still being caused to young adults who are in one of the lower risk categories, but there are people in that category who have been in intensive care units. So it isn't a free-for-all for everyone who's under 30. We've got to think about how we manage that risk across the whole population and recognise the risk that is there for all of us. So again, when you hear the First Minister's statement on Friday, you can expect to hear and see that balance of risk and how the Welsh Government has tried to address that to unlock more freedoms for the people of Wales in the safest way possible.
On the financial front, Scotland have introduced a COVID-19, I think it's a coronavirus carers allowance supplement, a one-off £230 per unpaid carer. What plans do you have to do the same in Wales?
Well, we're still looking at all of the areas where we can support people, and we recognise the contribution that unpaid carers continue to make, and in particular have had to do so even more, if you like, during the coronavirus pandemic. So we're looking at a range of options. I can't put figures into the air or whether there would be any sort of financial package around it, because we've got to have a very difficult conversation about what we're doing on meeting the coronavirus pandemic. You may or may not have heard the finance spokesperson for the Welsh Local Government Association this morning talking about the reality, the financial impact on local government and the essential services they're providing. There are some very difficult financial choices to make in balancing what we're able to do, and we'll have to think about all of those at the same time. So I appreciate that may not be the answer that you want, Tom, but it's much better for me, I think, to be honest with you about what I can do as well as what I can't. Take care, Tom. I've now got, finally, Gareth Exendery from the Caerphilly Observer.
Diolch yn fawr. On the UK-wide tracking app, what percentage of people in Wales will need to use the app for it to deliver accurate data here?
I don't think it's actually about the percentage of people that need to use the app. I think that's the wrong question, actually, because if we have Test, Trace, Protect here in Wales, we could run an effective contact tracing system without the NHS X App that's being trialled on the Isle of Wight. What the app would do, though, is it could help to speed up that process and, if you like, add another arrow and put something else in our armoury to help protect people and to make the system more rapid. Now, that helps us in one way, but there'll still be a need to reinforce that, because one of the lessons that is being learned on the Isle of Wight is technology can be really helpful, but to actually spur the human response in changing people's behaviour, speaking to another person has actually been even more effective to reinforce what the technology can do. And the trial isn't complete. We expect there's a further version of the app that's going to be rolled out. And as I say, it still remains my view that if it works, if the privacy issues are resolved, if the technology is rolled out in a useful way, if the data can go into our system, then I would much rather that is available to us to add to what we're already planning to do with our Test, Trace, Protect programme.
Before I ask my second question, then, you say you don't want to get into specifics around percentages, or that maybe that's not important, but senior epidemiologists say it's somewhere between sort of 60 and 70% in order to give you reliable data that makes the app useful at all. Is that sort of a number you would agree with in sort of the data you've seen or the research you've seen?
Well, look, I've seen figures about the percentage use, but I think that's the app in itself. And if you were just having a technology-based system, you'd need to have a high level of buy-in to do so. But even if there was a lower level of usage, it could still be useful, but together with the wider Test, Trace, Protect programme, the number of contact tracers we'll have in place, the manual contact with people that's going to take place, the telephone calls, and even there we'll be able, within the system we're creating, to send out email messages and text messages to people who are contacts of someone who has got symptoms or someone who is a positive case. So using a variety of different means of technology, the app could be useful in itself, even if 60% of people don't download it. But we won't just be relying on the app itself to do contact tracing for us. We'll definitely need people who'll be able to do that and to understand the local area, to help people and to direct them to places to go and get help, seek advice, or indeed where they could go to get their test and to find the place to do so online.
And finally then, we've seen large numbers of people turned away from recycling centres in Caerphilly as they've reopened today. Is this a pattern you expect to see repeated during each stage of lockdown lifting? And what can be done to ensure that when particular lockdown restrictions are lifted, thousands of people don't all rush at once, say to beauty spots when the exercise restrictions are lifted?
Yeah, it's part of the reason to take a cautious approach. If you unlock everything in one stage, then you do potentially get all that sort of pent-up demand and frustration that I know exists, all turning out within the first few days. Other authorities taking slightly different approaches. So the Vale of Glamorgan, they're taking an approach where you need to make an appointment, you need to book a slot to go, and so that's managing demand. But I think what will happen with the recycling centres is you'll see after a period of days it'll return to something more like normal. But managing the coming out of lockdown on any of the measures is difficult. It's not straightforward. And we do want to make sure that we avoid the sort of large congregations of people that we saw before we introduced lockdown measures around beauty spots. If people can travel a further distance for exercise, if that can take place, we need to think very carefully to make sure those sites aren't overwhelmed. And the harm we're all trying to avoid isn't somehow recreated in one of those steps, because our job is to keep Wales safe, and that'll continue to be the guide to all of our decisions here in the government in the days and weeks ahead. Thank you for your time again, and I look forward to seeing you next week, if not before.